Kaleidoscope, focusing on people who make a difference in Northeast Ohio communities.
Good morning, everyone. Welcome to the broadcast today. The Mount Sinai Healthcare Foundation recently awarded OhioGuidestone $160,000 grant to establish a program to help low-income children and families who've experienced trauma. OhioGuidestone is working with Northeast Ohio Neighborhood Health Services, or NEON, as it's called, on the Child-Parent Psychotherapy Project. NEON's Chief Operating Officer, Karen Butler, and OhioGuidestone's Vice President of Community Counseling, Holli Ritzenthaler, are both here to share with us more about this. Later on, we'll hear from the Clinical Coordinator for Cleveland Clinic's Asthma Center, Stephanie McCarroll. She'll tell us about a partnership with the American Lung Association to educate the community about lung health and wellness day. And on the broadcast after that, we'll hear from Adam Lettner of Mattress Firm and Tamika Taylor from CASA of Summit County. They'll share with us how you can help make a positive impact on the lives of foster children. Good morning again, everybody. I'm Leon Bibb. This is Kaleidoscope in our 18th year, I should add. And so we begin on the broadcast today with Karen Butler seated next to me and Holli Ritzenthaler seated to the right there. Karen, you're Chief Operating Officer for NEON, and Holli Ritzenthaler is Assistant Vice President for Community Counseling for OhioGuidestone. Good to have you both with us.
Thank you for having us.
Yeah. First off, let's begin. What does NEON do? A thumbnail picture of what NEON does.
So NEON is a community health center network. We were established in 1967, and last year we celebrated 50 years of service to the community. We're dedicated to providing access to high-quality primary health care services and reducing health care disparities within the greater Cleveland area.
Yeah. And OhioGuidestone, what does it do?
So OhioGuidestone has been around for over 150 years, and we are a community solutions organization. We work in over 20 counties throughout the state of Ohio and provide services to more than 30,000 children and families.
You got a big grant to help children now, children who are dealing with trauma.
Yes.
We're seeing much more of that, aren't we? What do you mean by trauma? What kind of issues are children dealing with?
Sure. So trauma is abuse, neglect, also experiencing domestic violence in the home. It can also include parents who have a mental health issue, substance abuse, incarceration. All of those can be adverse experiences for young children and the experience of trauma.
Yeah. And your organization is helping get the word out, get what they're doing to the folks who come to you for help in NEON.
Absolutely, and the folks in greatest need. NEON is one of the largest community health centers with over 7 locations, and our health centers are located in medically underserved areas. And what we know is that these areas are typically disproportionately impacted by poverty and by violence. So this partnership really makes a lot of sense, and our executive leadership, our Chief Operating Officer and President Willie Austin, along with our medical director, Dr. Anita Watson, certainly they unanimously endorsed this partnership because they recognize the need to provide early intervention for children who've experienced traumatic events and the impact that that has.
Holli, you really can't question a 5-year-old about trauma. How do you get to the kernel of the problem with a youngster of that age?
Yeah, it's absolutely essential that we're working with the primary caregivers, and what we've established is a very simple screening tool that's used in the pediatric setting. So the nurses and the pediatricians are working with caregivers, asking them about experiences that the child has had in the home, in the community. And through asking for a total number of experiences the child has had, the doctor can then assess how much trauma the child has been exposed to.
And then what do you do with that with that information? How do you help? How do you help the child? How do you help the family?
Right, so we are able to incorporate this within our treatment for the patient. And what it allows NEON to do is to integrate the response that we provide to the medical needs of our patients with their mental health needs as well. And that directly supports our model of holistic care.
Now, this is a 2-year program, as I understand it.
It is.
Now, you're just kind of setting this up.
We're actually in year 2 right now.
And how has it been for the last almost 2 years?
We have screened over 1,000 children so far and referred about 20% of them for early childhood mental health services, so they're getting mental health treatment early for their exposure. And we also have a clinician that is based in Neon and Southeast centers to work directly with the staff there to connect with families. So we're doing warm handoffs and supporting the staff in understanding the impact of trauma on long-term health of their patients.
How big an area can you serve? And how do people get to your services so that I can get my kid, my child, some help?
So we invite our viewers to contact us at 216-231-7700 to inquire about our services. And then we've been working very closely with OhioGuidestone to disseminate information to make people aware of this program so that they can avail themselves of the services.
Before we started the broadcast today, you were telling me you've got 7 health centers,
yes,
correct?
We do.
And this project is in 2 of those health centers.
This project is in 2 of those.
You want to expand that?
It is definitely our hope to expand that. So with the early results that we're seeing, we certainly hope that we'll be able to do that and benefit so many more people.
Also, I mean, when I was a kid growing up, as you and I chatted a little bit before we started the broadcast, when I was a kid growing up, we didn't have all of this kind of trauma.
Right.
The world has changed for children, hasn't it?
It really has, and what we're seeing is we're already seeing children age 1 to 6. Over almost 50% of them have already experienced an adverse event like abuse, neglect, or those other traumatic experiences I talked about. So prior to age 6, they're already having one of these experiences, and as we know, once you have one, the likelihood of having more is greater. So getting in, getting early, and impacting the family environment and community is so essential.
Okay. We got some phone numbers on the screen where our audience can get more information on everything we're talking about, and as well as websites. That's 440-260-8300, as you see on the screen, or you can go to 216-231-7700. More information on everything we're talking about. We wish you well. Thank you for what you're doing with the kids.
Thank you so much.
Yeah, OhioGuidestone and Ohio Neighborhood Health Services, or Neon, working together hand in hand, all to help the children.
Thank you.
Lord knows we need to help the children.
Yes, we
Many
do.
thanks for being on the broadcast.
Thank you so much.
Karen Butler and Holli Ritzenthaler. Good to have you with us.